The strike embarked upon by health workers has been lingering for about 2 months now.
Right.
Worst hit by the strike are expectant mothers who often fall under the pressure of running to and train traditional birth attendants, some of whom use sterilized instruments to take their delivery.
Yes, indeed. And Jacqueline Ogo in this report takes a look at this worrisome strike.
Call it a long journey or a strike. It has lasted for 2 months. The Joint Health Workers Union, JOHESU, wants no compromise in the payment of its entitlements. The workers say, to the government, the doctors have become the goose, and what is good for the goose is very good for the gander.
If you don't take care of your structure and your personnel, for them to be able to do what you want them to do, it's a big problem. And such thing the government needs to address. Somebody is shouting and crying, I don't have money, enough money, and the next thing is to remove salary again. You are worsening the situation. If the workers are not well taken good care of, these patients cannot be well taken good care of.
Amongst the worst hit in the strike, which the federal government has been seeking a permanent end to across the country fruitlessly, are expectant mothers. Labor for childbirth cannot be postponed for striking workers to resume on their duty post. So many women are faced with falling into the hands of quacks, thereby strengthening the stronghold of maternal mortality through the intervention of untrained traditional birth attendants. But there are voices asking the striking workers to temper their call for financial justice with some mercy.
I put up something, I said, instead of JOHESU, let's have COHESU, where it is collaboration of people, where it's coalition of people.
What the government is preaching is we must all work together as one to give Nigerians, which is the patients, the actual benefit they should have to determine. All these rancors of different professionals fighting or quarreling of strike will not help the patient. We must come to a round table to really discuss the way forward as it relates to health system.
My visit to Ifako General Hospital for a situation update on the strike met a brick wall. The chief medical director said he would not say a word without being ordered to do so by his boss, the Commissioner for Health. The chief medical director and the public affairs officer of Bagada General Hospital were also not available for comments. Dr. Jide Idris, Lagos State Commissioner for Health, in a phone call, promised to get back to us. Without the permission of such authorities, patients cannot be accessed for comments. Meanwhile, Nigerians who are feeling the damaging weight of the battle for money and better work conditions between the federal government and the Joint Health Workers Union are appealing for more attention and compassion on the human lives on the line for quick and effective solutions that would bring a speedy end to the biting industrial action. Jacqueline Ogo, TVC News, Lagos.
And we have in the studio the Chairman, Senior Staff Association of University Teaching Hospitals. Of course, that's Wale. Comrade Shaba Adetokunbo is the Chairman of JOHESU Luth Branch. Thank you for joining us on the show. And with him is Comrade Wale Olatunde. He's one of the National Chairmen of JOHESU. Good morning to you and thank you for joining us.
Thank you very much. Good morning.
So why the lingering crisis? We know there's been a back and forth of series of rounds of meetings between the government and JOHESU, yet no agreement has been made. Why is that?
Thank you very much. I want to start first by apologizing to Nigerians, especially the vulnerable citizens of this country who do not have the opportunity and the grace of traveling out of the country to access healthcare. It is a painful decision that we had to take. Nobody is happy about it. We expect that it shouldn't even last for more than 48 hours. And that was why JOHESU, in recommencing this ongoing strike, gave government 66 days notice. 66 days. Go and look at all labor laws. There's nowhere it says you should give that length of time. And the issues at hand are issues that started in 2009. Please, JOHESU members have tried enough.
We've heard those issues over and over again. Of course, it's not the first time we're bringing JOHESU here. But for the benefit of Nigerians, including patients who, of course, many may have lost their lives already. I wonder if we even have data of the human and financial cost of this JOHESU strike. What exactly is at the core of this strike?
Thank you very much. You see, the major problem we have is the insincerity on the part of Federal Ministry of Health. If you look at, right even before the beginning of negotiation with federal government through the Federal Ministry of Health on the issues at hand, they have taken a position that it will never happen.
Like what?
We had an agreement, had issues, went to court. Court gave us judgment. We are justified to have this. Go ahead and give them this. Over a period of time, we sat down. We had a small strike action for about 10, 12 days last year, September. We resolved. We signed an agreement with implementation period of 5 weeks in September. This is the 8th month. And we are still talking of discussing that same agreement that we have all concluded what is left for you to implement. And you keep coming around at every negotiating table that we have to start all over again. And that is the bone of contention.
And why don't you want to start all over again?
We are starting, there is nothing to start all over again for issues that have been concluded, that we are at the point of implementation.
Okay. To Comrade Shaba, right? First off, it looks like the opposition on the part of the NMA, the Nigerian Medical Association, is what is delaying all of this, because they are insisting you guys at JOHESU cannot be asking for parity. Though I've heard over and over again that what you're asking for is not parity, but equity.
Yes, please.
What exactly, why is the NMA that should be on the same boat with you guys, you know, vehemently against what you're asking for?
Well, to us,
yeah,
they have the power. They have everything. If you look at our own system here, from local government level to the national level, the people that are in the helm of affairs are all doctors. And if you look at our system too, either the commissioner or the ministers, they are all doctors. The moment any government tries to bring any other health professional or anybody to that system, you will see the first professionals that will attack the government on that will be the enemy. It was during the period of President Olusegun Obasanjo that he was able to appoint a non-medical person as a minister. And if you look at that period, we have relative peace, understanding. So
you think a non-medical person in charge of the Ministry of Health would do a better job?
If you look at those advanced countries that we are migrating to for treatment, where we have a majority of Nigerians who are specialists in different fields in the health profession, you can see that they are doing better because their environment is very, very conducive. We have in the health sector, we have people that studied health management, and they were able to manage those health institutions perfectly well. We can also do the same in this.
Yeah, but it seems it's more of environmental than the fact that you have medical or non-medical doctors at the helm of affairs in at the health departments over there.
Yeah, you see, our people many have been telling Nigerians that international best practices. And to us, we have been saying, look, if you want to use international best practices, let us bring it to the table. Let us implement it, and let us have progress. The same people that are saying international best practices, the moment you are saying that, they will also be the one that say, no, this is Nigerian, leave that. This is Nigeria. We must do it in our own way. To us, if they like to introduce British system, we are ready. If it is American system that will resolve this issue, let us go with it. Okay. But we are not saying, we are not against any system that the government is trying to introduce to bring peace to us. But what we are saying, look, we are all human beings. I decided to be a pharmacist or a nurse or an administrator. That suits my own purpose. And that is where I derive my joy from. Everybody cannot be a doctor. You get it?
True.
So that is the problem.
Now let me come to you, Comrade Odatunde. How do you get the attention of the government. Earlier, you talked about, you apologized to Nigerians because they most of them kind of go abroad for treatment, meaning that most of these people are not directly affected. So why are Nigerians the ones paying for this? Yes. Can't you be working while you agitate?
Well, like I said earlier, we have been pushed to the wall. We have been pushed to the wall. Like I said, we started this struggle since 2009. And we have been doing that. We have been discussing, we have been negotiating, we have been pleading. And that is why JOHESU is asking that there should be a complete reformation in the Federal Ministry of Health. A situation where you have the Minister of Health as a medical doctor is an interested party, the Minister of State for Health, a medical doctor, an interested party, Director of Hospital Services, an interested person, and of recent, the Permanent Secretary in the Federal Ministry of Health, a medical doctor. Go to Labour Ministry that should be an independent and an unbiased umpire, headed by a medical doctor. And that is why issues that come to government do not go beyond their table, because they remain parts and parcel of NMA, and they are playing the NMA agenda. It is surprising, it is strange, where a group of professionals who claim they want to decide the career progression, and the fate of others. Nigerian labor laws does not allow that. Everybody go and make your own point.
Are you saying that the NMA does not recognize the importance of a group that makes up to 95% of Nigeria's health sector?
That is exactly the position. And some of them are living in ignorance. They keep talking about, like you said, best practices, international best practice. The minister came on here some time ago and said it is the birthright of medical doctors to head the health team. For crying out loud, the WHO, as it stands today, who is the head of WHO? It's a biologist. It's not a medical doctor. Go to developed countries with good health indices. The head of health ministries are headed by non-medical persons, lawyers, economists, accountants, administrators, and the likes.
Comrade Shaba, would it be unfair to say that JOHESU may just be enjoying the strike for as long as it lasts? Because you have other private practice anyhow that makes up for whatever you're not getting from the federal government.
To us, none of us own any facilities, any health facilities, or in any business. As you are quite aware, if you don't know, let me inform you, that even within the government health institutions, that the doctors are the one heading them now. Majority of them have their private hospitals, and all those areas that introduce PPP into, whenever they are called to come and see any patient in those areas, apart from their salaries and allowances, for visitation, the least amount that they will collect is 25,000 naira. And all those labs that they are bringing into the system, any form that is being sent to any lab, 10% of any cost belongs to them. And none of us that are health professionals benefit anything from the system. So the people that are benefiting from this ongoing strike, they are the people in the health affairs, they are the doctors, because they have private institutions and they benefit from the system. Let me tell you, majority of these patients, they are very happy that this thing is even happening.
The patients themselves?
I mean the doctors.
The doctors, okay.
Because majority of those patients have been taken to their own private institutions. You know it. And you see, we don't have any power, but we only have God Almighty, who cares for you and me.
Okay.
In addition to what he said, the laws in this country today only allows medical doctors to hold hospitals. So who runs this private hospital? Definitely not JOHESU members. They are the ones. And that is why they are deliberately encouraging and prolonging this strike, because they are making more money from it.
Okay, the Minister, Isaac Adiwole, said that there was no agreement, between the government and JOHESU prior to President Buhari's administration. What do you have to say?
Thank you very much. You see, it's unfortunate that people at the helm of affairs misinform government. The minister came out and informed the people of this country that there was no agreement between JOHESU and government. That was his first statement. But when we came out with evidences of where he signed And the agreement we had, that was when it changed to say, okay, there was indeed an agreement, and the only agreement was after Buhari came into power. After some time, it now changed to say, okay, we are discussing and negotiating. Then what did you agree on? So it is, you see, government go, government comes. Issues remain.
Yeah.
They have inherited it. And they saw the wisdom. But the problem we have is that people are not giving government the correct perspective of the problems at hand. The minister will go to FEC, the minister will go to the presidency and inform them what they are asking for is equality. And we are saying what we're asking for is equity.
Have you been loud enough for the federal government, for the president first of all, at least to hear from you? Have you been loud enough?
We are trying our best. But you see, one, the common man, well, they said the court is supposed to be the last stop of the common man. We have been there. We have gotten judgment. We have passed it. Relevant agencies of government have them. We should also be asking them, what are they doing? Their Accountant General's office represented the ministry on several occasions in these court issues.
Speaking of going to court, the health minister and, of course, labor, they've gone to the industrial court of arbitration. And we hear from JOHESU that if that is the case, that you will end all negotiations. So where does this leave the Nigerian, whom you have apologized to for not taking care of their health and, I mean, not being there at the hospitals? What happens then?
Well,
Comrade Shaba.
Well, we are not aware that they have even been to any court at all.
Okay.
So maybe, you know, in time of crisis, people use propaganda and tell the public lies. To us, we believe in the rule of law. That is why whenever we have any challenge with the Ministry of Health or the government, we prefer to go to the court. And that is why, as I'm telling you now, we have 9 judgments that have not been implemented. And even when the Honorable Minister visited my own facility
at Luth,
we brought all these issues to him personally. That was when he was first when he got his appointment. And he was going around all those hospitals. And he met with us. We requested for a meeting. And he met with us. And we presented all these issues to him. He said, he made it categorically clear to us that court can say, do whatever they like. But in the ministry, it is him that will decide whatever happens there. So we are quite surprised that as a minister, you have to be neutral to everybody, because that office is for the progress of the generality of Nigerians.
Are you still insisting that he should be sacked?
Yes, that's our position.
Look, if that's the best solution to this ongoing crisis, for Nigerians to enjoy the dividend of democracy, no position in life is permanent. And whatever position that you find yourself in life as at any given time is by the special grace of God.
And if you say they should remove the minister, really, of course, a medical doctor. What about other medical doctors manning in positions? Would that solve the problem? Because the minister said that JOHESU made 15 demands in 2017, September 2017, which some of them were minutes, agreements were minutes anyway. You made 15 demands, and out of those 15 demands, 14 have been met. There's just one that remains, and they are working towards it.
Let me tell you, he can say anything in order to deceive the generality of the masses. Let him enumerate all those 14 items. Or let him come on here with us. You get what I mean? Let him come on here with us to come and tell us what he has done.
So in other words, government has not made any commitment at all.
At all.
Based on your demands. And I didn't even know there were up to 14 demands anyway. Are you able to paint a picture very quickly, we need to round up now, about what exactly is happening at the public hospitals, the general hospitals right now?
Painfully.
The conditions of patients,
Painfully, the hospitals are empty. That's the truth. Forget whatever propaganda anyone is telling us about we are working. Working doing what? It's a blatant, it's painful. But the hospitals are empty.
But some states, like Lagos,
Lagos State,
Yobe and
we granted them waiver.
Okay.
We granted them waiver based on commitment. of these state governments.
Commitment in principle?
In principle, that is to show you that JOHESU has a large heart. We are not interested in strike. And that was why we gave these states waivers to show that we are always available for negotiation. And we're also repeating, it's not as if we abandon negotiation. What we say we are no longer going to do is if you have negotiated over 5 times with somebody that is obviously biased, that is not ready to respect any court judgment, then there is no reason why we should continue.
Okay, so now, is there any other meeting scheduled or stalemate?
We are expecting the Office of the Secretary to the Government of Federation to be an arbiter on this case. Okay. We have lost complete confidence in the Ministry of Health and the Ministry of Labour to arbitrate.
Okay. Thank you very much, gentlemen. Wale Olatunde is one of the national leaders of JOHESU, and Comrade Johnson Adetokunbo Shaba is Chairman, Youth Branch of JOHESU. Thank you, gentlemen, for coming. We hope this is resolved sooner than later.
We are praying harder that it should be resolved very soon. Yeah.